Thanks so much for joining this webinar tonight on Shot of Knowledge, Motivational Interviewing to Improve Vaccine Confidence from the Rhode Island Immunization Program. It's good to have you all here with us. Can I have the first slide, please? So just a quick overview of our agenda. We'll go through just a few housekeeping things and learning objectives, and then I will turn it over to tonight's speaker to go over some information on motivational interviewing and some techniques there. And then at the end, we'll have some time for some Q&A and some resources. So if, as you think of questions, go ahead and put those in the Q&A. The chat is disabled, but please use the Q&A button to put your questions in as they come up this evening. Thanks. Next slide, please. So just a couple of housekeeping things. So a recording of this presentation will be available on the Rhode Island Department of Health's website. The views of the presenters here tonight are our own and don't necessarily reflect those of our respective organizations. As I said, please use the Q&A box to put in any questions that you might have, and we'll get through as many of those as we can. And at the end, please take just a couple of moments to answer the survey questions. That really helps us figure out what we can do to meet your needs and make sure that the content that we're developing is on target and able to help you improve immunization rates where you are. Next, please. So a couple of learning objectives. So we're going to go through the key principles of communicating with vaccine hesitant individuals and talk about presumptive recommendations and evidence-based tools like the 3Cs and the AIMS framework. We're going to apply motivational interviewing techniques and learn how to respond effectively to parental and patient concerns about vaccine safety and efficacy. Next, please. So I am Dr. Michelle Fiscus. I am a board-certified pediatrician, still in some practice, and the Chief Medical Officer at the Association of Immunization Managers, which is a national nonprofit that supports the 66 federally funded immunization programs across the country. And tonight I am joined by Dr. Emily Messerli, who is the Chief Programmatic Officer at the Association of Immunization Managers as well. She's going to be presenting tonight on motivational interviewing. And just a couple of things about her. Dr. Messerli is a certified family nurse practitioner and the former Kentucky Immunization Branch Program Manager. She received her undergraduate degree from Emory University and her doctorate in nursing from the University of Kentucky. She has also served on the board of directors for the Kentucky Public Health Association and on a work group for the Advisory Committee on Immunization Practices. So I will turn it over to Dr. Messerli, who's going to take us through tonight's program.
Thank you so much. Thank you so much, Shelley. So I'm going to start with thank you everyone for joining us tonight. And as Dr. Fiscus mentioned, she's a pediatrician. I'm a family nurse practitioner, and I also do still practice and work in a clinic with VFC vaccines, and we give vaccines to uninsured children who are new immigrants to the United States. So just want you all to know that I do practice what I'm speaking about. So I'm going to start off with some data that was published recently in a Kaiser Family Foundation and Washington Post survey. This is a really recent survey that was done in the fall of 2025 covering vaccine confidence and hesitancy. Next slide, please. So this recent survey showed that a strong majority of parents express confidence in the long-standing childhood vaccines, such as those for measles, mumps, rubella, and polio. However, confidence seems to wane when it comes to those seasonal vaccines like influenza and COVID, with much more parental hesitancy. Approximately 16% of parents have reported delaying or skipping vaccines. That's excluding flu and COVID-19. So indicating there is still selective vaccine acceptance out there. Next slide, please. So why have actually these hesitancy concerns come up? So concerns about side effects contribute significantly to vaccine hesitancy. Lack of trust in vaccine safety also came up, and this has really deepened parental skepticism. Misinformation and inconsistent public messages. I think we've been seeing a little bit of that in the media recently, have increased uncertainty about vaccines. Transparent communication and engagement with trusted healthcare providers is so key to restoring confidence, and that's exactly what you all are here to learn about today, and what I will go over with you and share a lot of resources about that. Next slide, please. So we received some information from our partners who we're presenting for at the Rhode Island Department for Public Health. And the Rhode Island Public Health Association recently did some surveys. So this is more survey data from actually your residents in Rhode Island. So Rhode Island residents generally had positive attitudes about vaccines and found them easy to access. The concerns expressed were mostly about COVID vaccines. The concerns specifically were lack of information, vaccine ingredients, and specifically those combination vaccines where there's more than one vaccine in a vial or in a syringe. Side effects of vaccines were also a concern. And those top three really are in line with that Kaiser Family Foundation data. One thing I found interesting is that your folks in Rhode Island, when they were surveyed, outcomes of getting the disease was a concern that came up. So what I think the Rhode Island Health Department has said, you know, if we know that we have outcomes of getting the disease as the top concern, we need to make sure that we're educating about the outcomes of those diseases. Also, that we're educating about vaccine ingredients, potential side effects, and that we're making sure to leverage those CHWs or community health workers, working with school programs and summer camps, and having public seminars. So those are some of the things that the Rhode Island Public Health Association is planning to do in response to some recent surveys on public sentiment. Next slide, please. So the last bit of data that we got from your health department survey was on a recent AA1 project. For those of you in the health department, that's just the name of the funding source for this grant. But they were looking at the Vaccinate Before You Graduate, or VBYG program, if any of you have seen that mnemonic at all out there. But overall, knowledge of vaccines was easier and more equitable than in their origin country. So this survey was of a lot of immigrant families. There were concerns around COVID, new vaccines, language and cultural fluency. The parents had concerns with. The provider is the most trusted resource for vaccine information. You're going to get tired of hearing me say that in this talk, that the provider is the most trusted resource for vaccine information. Not only did parents in Rhode Island want more information on side effects, they wanted to know how bad the disease that the vaccine is preventing would be. So how bad is that disease? What's that impact of not getting the vaccine? There was some low knowledge of that Vaccinate Before You Graduate program for adolescents. So it looks like you all are going to be doing some more promotion of it. Adolescents overall had a high confidence, didn't really know how vaccines worked, but in the end, they felt that it was ultimately their parents' choice. Next slide, please. So the main reason that you all came here today is not to figure out why people have vaccine hesitancy, but because you know that they do. So what can we do about it? So leaning on evidence-based tools, the AIMS framework is actually an excellent toolkit. And I know that my colleague Shelley, who is from Indiana, would be happy to know that researchers from Indiana University and Purdue were the ones who developed this AIMS framework. So the AIMS is informed by scientific research from multiple disciplines. It can be adapted to context, culture. It can be tailored to work in today's challenging healthcare environment. Feedback from multiple trainings with healthcare providers in more than 20 different countries suggests that this approach can be a vital tool in efforts to increase vaccine acceptance. This AIMS framework that we're going to go over, 93% of participants felt empowered to proactively talk about vaccination with their patients. and 80% believe they acquired the skills that would help their daily practice. Now, I'm going to just go over the lessons, but we'll share a resource at the end where you all can do a training on your own and receive CME for it. You can also share this training with providers in your practice. So this lesson, AIMS, is the announce, inquire, mirror, and secure. So announce means you should give a friendly but presumptive recommendation for a vaccine. There's an example here. I'm not going to read all of the examples. We don't have time to do that, but you can see an example and you'll hear some examples in our scenario that Shelley and I do, Dr. Fiscus and I do later. So you want to start by giving a friendly presumptive recommendation. The inquire, you don't want to inquire automatically if you get a question. So most of the time, an announcement method works. If you get questions, inquire and actively listen to their concerns. Next slide, please. So then you want to mirror. So of course, this is an acronym, AIMS, and they use mirror. But what mirror really means is reflect. Reflect the patient's words and concerns to get that trust. You need to build trust and understanding by repeating back what you heard to make sure that you heard and that they know that you're listening. It's all about the relationship. The patient wants to know that you're listening to them and not talking at them. I think an example here that I will read out loud is when someone expresses a concern to you, if you simply say, if I thought that were true, I'd be scared too. That's just humanizing what they're experiencing and bringing it down to the level that you understand. That would have been scary if I had heard that side effect of that vaccine. So the last in the AIMS is securing or reestablishing that patient trust in the end. So no matter what happens, and again, you'll see this in our scenario later, it's really important to strengthen that trust no matter what the outcome is, whether they're hesitant and aren't getting the vaccine that day, or if they actually just say, no, I don't want any vaccine. The most important thing for a provider to do is to maintain that trust, to maintain the trust that the patient has in you. And again, 90% of trainees with this program felt more confident and 60% saw an increased uptake in vaccine recommendations. Next slide, please. So the key lesson in the AIMS is the announce approach, the presumptive recommendation. How you frame when a vaccine is recommended is really important. And there's three kind of typical ways that providers recommend vaccines. It's either absent, it's weak, it's vague, sometimes it's participatory, but those are ways that research has shown don't work. So skipping the recommendation altogether is happening more and more. We know providers have hesitancy with recommending flu and COVID, and they just don't recommend it. We avoid conflict. But by avoiding that conflict, we're also squandering trust. That weak recommendation is saying that it's an option for people your age, rather than saying all people over 65 should get the flu vaccine. So sometimes absent, sometimes weak. Next slide, please. This third one, the suboptimal one, the participatory recommendation, is one that I've personally heard when I've been in a clinic with one of my 3 children, now all grown adults. But I've been asked if I want to give my child a particular vaccine. It happened with the HPV vaccine. Providers still to this day say, would you like to get a flu shot? So you're literally giving the patient the option to say no. So a presumptive recommendation is really what you want to do. Next slide. So healthcare providers, did you hear me say that before, are the trusted messengers? So we know there's mistrust in hospitals, health departments. We know that trust is local. We also know that healthcare provider trust transcends politics, meaning that 80% of people, left, right, center, still rank their doctor as the #1 choice to protect their health. Next slide. So communication is the key, trusting the messenger, not giving a lot of data, and the business of behavior change is also really important. Behavior drives the outcome more than any other factor. How you speak to your patients, how you interact with them. So better patient behaviors, better outcomes follow from better provider communication. Next slide, please. So these last two slides actually have some really detailed ways of how you can answer questions. And you'll get this from one of the scenarios that we do in a moment. It's not really what you say and what you know, but it's how you say it. It's not that you need to know everything and be an encyclopedia on vaccines. It's how you respond to the questions that you get. One of the key takeaways from this slide that I like to say is think about FAQs. What are the most common questions that you have heard parents, grandparents, caregivers, children, adolescents ask you about a vaccine, and have that arsenal of answers available so that when you get the most frequently asked questions that you get in your practice, you know how to answer them. Telling stories is important, and softening your tone is also really important. People just want plain language. They want you to be warm and engaging, and they don't want you to use medical jargon or explain statistics when they have questions. Next slide, please. So here's a key one. What if you don't know the answer? What do you do when you don't know the answer? The best thing is to be honest and say so. They'll gain your respect. Honesty gets respect, and commitment to saying you'll find the answer will get that trust. The key takeaway is that questions shouldn't be challenges. They're really opportunities for you to show how you answer builds trust and influences the behavior of your patient. The last one that I want to go over is just the sandwich. Starting and ending with something positive and putting something negative in the middle, maybe that you've heard your patient talk to you about their concerns about vaccines, can be a really great way to improve acceptance and comprehension and understanding. Next slide. So I want to go over, because you all had done a study on adolescents, parents, caregivers, and vaccines, there's a framework from the Unity Consortium called the 3 C's that I'm going to do a quick overview of. So why do adolescents and parents resist or avoid vaccine recommendations? They have anxiety about getting vaccines. We heard that about Rhode Island. They have concerns about safety or side effects, challenges about why they're needed. But with this program, with the 3 C's, and that's that presumptive recommendation, providers felt empowered, they felt comfortable, and they understood the value of adolescent immunizations in preventive health. Next slide, please. So the 3 C's is a confident, concise, and consistent training. It will be included in the resources at the end of this presentation, but it's an excellent way to watch a lot of really in-depth videos that give examples of how to respond with parents who have questions or concerns at specific age levels. They go into age 9, age 11, age 16, those really specific visits on how to respond to parents' questions and concerns. And it really goes over that presumptive recommendation, confident, concise, and consistent. And it's an excellent training program that I hope you all share within the clinics that you work in. Next slide, please. So the next thing that Dr. Fiscus and I are going to do is we are going to do some demonstrations. Just for clarity, I am wearing the stethoscope. I am the provider.
And I am the mom with my baby.
All right. So hi, Mrs. Williams. Tanner, although he's a little bit furry today, seems to be doing very well. He's really doubled his birth weight, and he seems to be hitting all those milestones that we like to see at 2 months. He's due to start his baby shots today. DTaP, which protects against diphtheria, tetanus, and pertussis, or whooping cough. HIB, which protects against a really dangerous form of bacterial meningitis. Polio, pneumococcal vaccine, which also protects against a cause of bacterial meningitis, and pneumonia, Hep B vaccine, and rotavirus, which is a vaccine we actually give by mouth that protects against a virus that causes a really terrible diarrhea. The most common side effects of these vaccines are fussiness, fever, sight redness, and tenderness. Some serious complications can happen, but are really extremely rare. Do you have any questions about the vaccines that Tanner needs to get today?
I don't really have any questions, but we really like to use more natural and homeopathic treatments for our children. And I don't know if you saw that we declined the vitamin K and was it the hepatitis B vaccine, I think, when we were in the hospital. We just don't want chemicals in our baby's body, and vaccines are pretty controversial now.
Hmm. It sounds to me like you're really interested in protecting your baby as much as possible, and that's just so important to you.
Yeah, I mean, I just don't want to give him any vaccines. I don't think they're natural, and I don't believe that our bodies really need them. The best way for him to build his immune system is to get whatever disease you think these vaccines prevent, and then at least there's not going to be any lab-made chemicals injected into his little body when he's 2 months old.
I understand. Would it be okay if I shared what I know about vaccines?
Yeah, look, doctors, they're not really taught that much about how to do things naturally or how nutrition is the best way to heal the body. And we're really only at this appointment because my mother-in-law said that we had to see a pediatrician. But I want to be really clear. I don't want to vaccinate my baby at all. And I just don't really want to talk about it anymore.
Hmm. I respect your decision, and I won't push this conversation if you're not open to it today. But I really wouldn't be doing my job as a pediatrician if I didn't tell you that vaccines are very important to keeping children, and especially infants, protected from diseases we can prevent, like whooping cough and meningitis. I do look forward to seeing you all in 2 months and at his 4 month visit. And in the meantime, can I give you some resources from places I trust, like like our children's hospital and Marches of Dimes? If you have any questions or you decide you'd like to have him vaccinated, please call. We'll be happy to bring you back whenever you think it's convenient for you.
Okay, I'll take what you have. Thanks.
Okay. So one thing that Dr. Fiscus wanted to make sure that we said was that, many times these are not that one and done conversation. I think we mentioned before that the clinician needs to build a trusting relationship with the parent. So if you notice, like there was no fighting, there was no citing statistics. We're trying to maintain that relationship so that you can have that conversation when they return and when they come back. So that's the hard part, is not getting in there for the good fight. Do we have time for the other scenario, or we do? Okay. All right. All right. So, I think today we have Mrs. Smith, Joey. Joey's here, and he looks like he's really developing appropriately and a healthy 4-year-old. He's kind of small for a 4-year-old, but he's a 4-year-old. So we talked about what to expect with his growth and development, but he's due for a few vaccines. He's due for the Tdap, which protects against tetanus, diphtheria, pertussis, and whooping cough. Polio and MMR to protect against measles, mumps, rubella, chickenpox, and flu, and COVID-19. He's had all these vaccines before and has already and as you know, the most common side effects, fever, redness, tenderness. You can always give him some Tylenol, some ibuprofen for comfort if you need. Do you have any questions?
Yeah, I've been doing a lot of research since the last time he had shots, and I feel like I know what's best for my child. And I'm not sure I really trust these recommendations anymore. I know we've gotten all of them except for COVID, up until this point, but I don't think we want to continue them. We just are at the appointment because it's a school requirement to get his physical signed off.
Oh, yeah. Okay. So, thank you so much for being honest with me. And I know there's a lot out there in the media about changes in recommendations. And I really understand your concerns about wanting to make sure you make the decisions that are right for your child. As a parent myself, I can understand wanting to make sure your child is safe, protected, and healthy.
Exactly. That's why I've done my own research. And, I'm just not sure the experts really even understand what's in these vaccines.
You've clearly put a lot of effort into learning and protecting your child. And it's important to you to feel confident about any decision that you make. So vaccines are like the best defense against many infectious diseases. And I know we both want to keep your child healthy. I hope we can work together to accomplish that.
Yeah, I just don't think parents should be pressured into injecting their children with chemicals.
So I hear that, and I want you to know that this is your choice. You've trusted me to provide care for Joey his entire life. But I only make recommendations. You do make the decisions. If it's okay with you, I can share what I know about vaccines, and we can talk through any questions or concerns that you have.
Yeah, and I guess I'll take a look at what you have. I don't know that it'll change my mind, but I'll look at it.
Okay. So what have you heard or read about that concerns you the most right now? So that's kind of where we end. You can open up that window to exploring what the parent is more concerned about. But you can see that it does take time and it does take listening. But we have preserved the relationship. We're not getting into an argument. So hopefully we've given you some examples of how you can maintain that relationship with a parent who has an infant, has a 4-year-old, and really wants to make their own decisions. Thanks. Thanks, Mom. All right, so next we're going to go and the key thing that I want you all to learn from today is knowing the resources that you have to educate in your own clinics and in your own communities to work on vaccine confidence. So a lot of the tools that I covered actually come from various toolkits that we have. So there's the Rhode Island resource kit. There's talking points in there, resources to address patient questions. So that's really Rhode Island specific. AIM has a wonderful vaccine confidence toolkit. There's a compilation of resources in there to equip immunization programs. And then there's a motivational interviewing for healthcare providers from the Alaska Native Tribal Health Consortium. That's a really great training. There are also partner resources for parents and adolescents. So depending on who your audience is, we have a variety of resources for you. Immunize.org is an excellent resource for providers and those who work in offices and are direct givers of vaccines. A lot of the AIMS training that you heard me go over, that AIMS framework, is part of that trusted messenger program. That's the last one on here. They have a free CME or continuing medical education opportunity. And then one dashboard that I didn't have time to go into that I do when I do a live training, the Frame Foundation with NFID has an excellent toolkit where they actually have a map showing data that's hyper local to understand how your community health attitudes, behaviors, and barriers would help. And this is specifically for adult vaccine uptake. Next slide, please. So I think next we're going to go to our Q&A, and Dr. Fiscus is going to lead us with that.
Great. So thanks, Emily, for all of that information. It was really great. So just a reminder, use the Q&A function at the bottom of your screen to put in questions for us to direct to either to Dr. Messerli or to the Rhode Island Immunization Program. They're all here to answer any questions that you have. But I'll start off with one to you, Dr. Messerli. So why do you think it is that healthcare providers seem to be a little more reluctant to talk about vaccines now?
So that's a great question, and I hear it all the time. There is so much misinformation in the media that I think parents come bombarded with information, and I think that what you and I showed earlier is that you have to be prepared for a patient like you, right? You have to have in your arsenal how to respond. You don't have to have the answers. That's the key. I think that providers are afraid of not having the right answer. I think that's one of the main reasons why they avoid opening up the conversation, is they think they don't have the right answer. And you don't have to have the right answer. You just have to listen.
Yeah, I think that's been my experience too, is that we as clinicians, are used to being the expert in the room. We want to be the expert in the room. And if someone comes at us with, SV40 or something about alum that maybe we don't know the answer to, sometimes it feels safer to just not have those conversations. And I think we can do a better job of saying, can you give me that information, or what was the source of that, and let me look into it and get back with you, and then make sure that we actually get back with them with the answer. I think that goes a long way. And then how should we be responding to parents who are concerned about what they've heard after January 5th of this year, when HHS came out with different recommendations than what we've had in the CDC immunization schedule up to this point?
Yeah. So in my practice, I've actually heard this more from the office staff than anyone, because they're maybe paying attention more to the news. But it's really business as usual. Vaccines are still recommended. Vaccines are safe. The insurance companies have said they will pay for them. AAP, AAFP, ACOG are all still recommending vaccines prior to that recent recommendation. And so we need to do what's best to protect our patients right now, and know that we're still able to give all the vaccines in the schedule that your state or your practice is following.
So I have a couple of questions that have come in now. So one is, I like how you presented the vaccine topic. However, most pediatric offices won't give parents options. It's all or nothing. And then they're referred to another practice. There are not pediatric offices that will defer getting them. How do you reply to that?
Can I turf that one to you as the
You
pediatrician?
can. So, I will just upfront say that I've never been a supporter of the idea that families have to vaccinate according to the schedule, or they can't be seen in your practice. And my main reason for that is that it's not the child's choice. to not get vaccinated. And I feel like those children need a very well-trained clinician to be able to deal with them when they get sick and to be able to identify diseases that we don't often see, like measles and, well, now we often see that, but diphtheria, pertussis, things like that. So I have never subscribed to that viewpoint, but I do think this requires a cultural shift amongst pediatricians that we can't expect with everything that has happened since COVID for parents to just come in willing to vaccinate their children and get everything just because we tell them that that's what they should do. The vast majority of parents are not anti-vax. I really try not to use that phrase at all, if I can. But they have questions, and most of what they're doing is done out of fear, fear of making a choice that they're going to do the wrong thing for their child. And sometimes it feels safer to do nothing than it feels to actually take an action like getting your child vaccinated. So I think we need to get more comfortable with the idea that parents may leave an interaction with us having decided not to vaccinate their child on that day, or maybe they've decided to give one vaccine and want to come back in a month to get the next one. But at the end of the road here, what we want is a fully vaccinated child, and that may just take us a little more time than what we've gotten used to. In my practice, I was the only practice in my county that accepted parents who did not completely follow the CDC schedule, not because I believe in that in any way. Absolutely, obviously, this is what I do for a living. I believe that it's critically important to get children vaccinated on time. But the alternative in my neighborhood was if they couldn't come to my practice, they were going to go to a practice around the corner that was completely anti-vaccine, that was prescribing helminth therapy, which is worms, and organic clay, and had a hyperbaric oxygen chamber, and was doing all kinds of things to children that are not grounded in science. And so I would rather have a kid that's partially vaccinated in my practice and get them all the way there than to send them off to a practice like that where I know they're never going to get the care that they need. So
Yeah.
I think we just need to keep pushing.
You're absolutely right about that ongoing conversation. As I think we demonstrated in our scenarios, you have to keep the door open, and you have to bring up the topic. And in the end, it's just establishing and maintaining that trust that they have in you.
Exactly. Let's see, we've got time still for another, maybe two questions. So one is how do you decide what a reasonable amount of time looks like in your practice for discussing the vaccine schedule with a parent before moving on? It's a good question for those of us who always have a crunched time schedule when we're dealing with parents.
Yeah, that's a tough one. Before moving on, like moving on and releasing them as a patient, you mean? Yeah, that's
Oh, no, I'm
or
going to interpret this as like just dropping the subject and moving on to
oh,
the
dropping the subject and
or
moving on. Right, right.
ending
Ending
the
the
encounter.
conversation.
Yeah.
Yeah, I think as long as you have ended the conversation, acknowledging what their concerns were, I think that's kind of a good way to end. And I think we demonstrated that before. Acknowledging that they have those concerns, and let's talk about this again, and not just going down the rabbit hole of the data dump. That's pretty typical. That you want to share your knowledge and share what you know, but just acknowledging, I understand that this is your concern. Are you willing to let me share information with you? They may say no, they may say yes. Let's talk about this at your next visit. Oftentimes that's how you have to leave it. Yeah.
Yeah, yeah, and I think sometimes it just comes down to what your schedule looks like too. You know, if you are
Absolutely.
just packed that day, then you may have to take a no as a no and then explain that
Hmm.
you'd like to continue this conversation and can I
Hmm.
email you some
Yep.
resources?
Yep.
And if it's a day where, maybe you're not so packed and you have a few more minutes to take some time and you feel like there's an opening there, that maybe you can try to step into that and see where you can go. I've got a couple of questions for Rhode Island specifically, so maybe I can have Lisa Gargano come on and answer those.
Yeah, that would be great.
Hey,
Hello.
Lisa.
Hi, everyone. Yeah, I'm happy to address them if you want to read them off to me, if you don't mind.
Sure. So the first one is, how does Rhode Island insurance cover costs, and are there free vaccination clinics in Rhode Island?
Sure. So we are very fortunate here in Rhode Island, and we are a universal purchase program for both pediatric and adults. So what that means is that through a combination of federal funding and assessments from the insurance companies, the state purchases vaccines for providers enrolled in our program. So our insurers are going to continue to support that program. They've supported it since 1992. So it's a very long-standing program. And the VFC program, even with all of these changes, that's the Vaccines for Children's program, which covers Medicaid children, uninsured or underinsured children, and Native American, Native Alaskan, I can't ever remember the order those are in, populations. Even with the changes to at the federal level, that program stays intact and vaccines are still available through that. So between a combination of that and the payment from the insurers, we're able to offer these vaccines for free. And we have received assurances that the administration costs for all vaccines will continue to be covered by Rhode Island payers.
And I will say the Rhode Island program is the envy of most of the states in the U.S., I think, because it is really one of the best programs that there is. We have one question. Are you planning on having a full motivational interviewing training for community health workers?
We are not, unfortunately, at this time. I have shared, I believe it's Vaccinate Your Family, has like a vaccine navigator program is that, and we've shared those resources out with our community health worker association to get that information out. It's free, it's available in Spanish, and it's fantastic. So those type of resources we share out through any of the channels that we have where we can reach community health workers. But there's nothing at this time, but I'm happy to have that conversation with those associations because those community health workers, as you saw from our local data, are really key for working with directly with families, as is we do a lot of work with our family visiting program, they also do motivational interviewing for themselves, but they also have a lot of training around vaccines because it is such a priority topic and a hot topic for parents to bring up when they come and visit.
That's great. And I will also remind folks about the resource that Emily mentioned from the Trusted Messenger program that can also be used for community health workers too. So thank you so much, Lisa and Dr. Emily Messerli, for doing all of this and participating in the Q&A. I've got just a couple of slides to wrap us up. One is to make sure you register for the next Shot of Knowledge webinar, Immunization Quality Improvement Programs. If you liked learning about motivational interviewing, come back for that one. That's supporting adult and pediatric vaccination in Rhode Island, and that's on March 24th at 7:30 a.m. for all of you early risers. And they'll have more details about that soon. And then don't forget to visit Rhode Island's Department of Health's website to view all of the previous Shot for Knowledge or Shot of Knowledge webinars that have been done, including this one that'll be up in the next few days. So thank you so much, both to Rhode Island Department of Health's immunization program and to all of you for coming on and joining us today. We hope that you learned something. Please take just a moment to complete the evaluation that's going to pop up at the close of this, and we hope to see you next time. Thank you.